Our body is controlled by our brain. The brain can tell us how to move our arms and legs or control how we feel. But sometimes your brain isn't able to talk to your body anymore because the cells, like neurons, that send signals to your brain get hurt by their own body. This disease is called multiple sclerosis. When your brain can't communicate to our body to the best of its ability, you can feel bad, get tired, have body pain, or even lose the ability to move how you want to move. Do you remember a time when you touched a hot pan, pulled your hand back, and said, "Ow"? Well, people with multiple sclerosis might not pull their hand back because their brain doesn't tell them to. And once you have this problem, you live with it for the rest of your life because there is no cure yet. But there are medicines to help with the problems you get from this disease.
Multiple sclerosis, also known as MS, is a disease of the brain and spinal cord caused by your own body. Your brain communicates to the rest of your body by sending signals through cells called neurons. Every sensation you feel and all the things your brain tells you to do is controlled by neuronal communication. Neurons have a protective covering called myelin sheaths that allow for efficient and fast communication. In multiple sclerosis, your immune system gets confused and starts to attack your neurons and the myelin sheaths. Over time, this can damage or destroy both the coverings and the neurons, and signals can get lost. Have you ever been on the phone with someone and you couldn't really hear them? This is because the phone signal was weakened or blocked. Now imagine your neurons are the callers and the degraded myelin in neurons are the cause of the weakened or blocked signal, leading to less efficient communication between neurons. This is what happens in multiple sclerosis. The important signals in your brain and body are disturbed, which can lead to mental degradation and even paralysis. There are some treatments that can alleviate the symptoms, but there's currently no cure to MS.
Multiple sclerosis, also known as MS, is a rare autoimmune disease that affects neurons in the central nervous system, which consists of the brain and spinal cord. The symptoms are very diverse between individuals and will depend on the location of affected neurons in the body and brain. It can result in symptoms of sensory loss, motor and spinal cord symptoms, and dizziness. The cause of the disease is unknown, but both genetic and environmental risks have been shown to increase the risk of MS. Myelin is a fatty substance formed by brain cells called oligodendrocytes and is associated with neurons. Myelin helps facilitate the transfer of signals through our nervous system in a fast and efficient way known as saltatory conduction, where the signal jumps between nodes of Ranvier, which are locations in the neuron with no myelin sheath insulation. In a healthy immune system, we have immune cells called T cells that protect our body from foreign invaders by killing other infected cells. However, in MS, the T cells, along with other immune cells, will attack the body's own central nervous system, including neurons and their myelin sheaths. Breakdown of myelinated neurons by the patient's own immune system ultimately leads to MS, which is why it is classified as an autoimmune disease. Although there is currently no cure for MS, there are things that can be done to relieve some symptoms. Certain medicines have been shown to decrease inflammation in the body. Additionally, supplements that dampen the effects of myelin degradation have also been shown to reduce symptoms of fatigue in MS patients.